How to lower high creatinine level. Creatinine is a waste product found in everyone's blood and urine. Creatinine and creatinine clearance tests show how well the kidneys are working. Under normal conditions, your kidneys should be able to filter and expel this substance from your body. Some health problems can prevent this function from happening and cause harmful amounts of creatinine to be produced. There are some ways you can reduce your creatinine level. These include changing the diet, making some lifestyle changes, taking medication and getting medical treatment. Step 1. Find out what creatinine is. Creatine is a waste product produced by the body when creatine, a metabolism substance that converts food into energy, is broken down. It allows the kidneys to filter the creatinine in the blood. The waste product is then excreted in the urine. A high creatinine level can be a sign of kidney problems. A high creatinine level can be the result of regularly consuming high amounts of protein or participating in a very strenuous exercise. Creatinine supplements also increase the level of creatinine in the blood and urine. Step 2. Understand how the test works. A creatinine test measures the amount of creatinine in the blood. The doctor may also perform a creatinine clearance test. In this test, the amount of creatinine in the urine is measured. The amount of creatinine in the blood should be low and the amount of creatinine in the urine high. In these tests, only the instant status of the kidney is shown. The tests measure the amount of creatinine in the blood and urine using only one-time samples taken within 24 hours. Interpret test results. The normal range of creatinine levels is different in adult males, adult females, teens, and children. The right value for you may vary depending on your age and body size, but there are general ranges you can take into account. Step 3. Understand why your creatinine level is increasing. There are many different reasons for high creatinine levels. Some of these reasons are more serious than others, but whatever the reason, you need to take steps to bring your creatinine levels back to normal. Renal failure. If the kidneys are damaged, the kidneys cannot filter creatinine from the body with glomerular filtration as it should. Glomerular filtration is the outflow of filtered fluid through the kidneys. Muscle breakdown. If there is a condition that causes muscle breakdown, the destroyed muscle tissue can enter the bloodstream and damage the kidneys. High meat consumption, a diet rich in cooked meat, can increase the amount of creatinine in the body. Thyroid insufficiency, failure of the thyroid gland can affect the function of the kidneys. Step 4. Drink herbal tea or green tea. Some types of herbal tea are believed to reduce the amount of creatinine in the blood. The number of studies supporting this view is limited, but the opposite of this theory has not yet been proven. Drink 2 glasses of herbal tea a day. Herbal teas that you should check out include chamomile, nettle leaves and chicory root. These teas increase urine production by stimulating the kidneys. This way, more creatinine can be removed from the body. Consider using a nettle leaf supplement. Nettle leaf can be helpful in increasing renal excretion and removing excess creatinine. Nettle has histamine and flavonoid. These increase the blood flow to the kidney and increase urine filtration. Nettle leaves can be used as supplements or as a tea. Consult your doctor for sage use. Sage is an herb that increases glomerular filtration rate. When the glomerular filtration rate increases, creatinine is easier to excrete from the body. Sage has lithospermat B, which increases the function of kidneys. Consult your doctor to determine how to use sage. Do not use sage without consulting a doctor. Step 5. Monitor your fluid intake. As a general rule, you should drink 6 to 8 glasses of water a day. Creatinine levels can increase when the body is dehydrated, so it is important that the body is not dehydrated. When you don't have enough water in your body, less urine is produced. Creatinine is excreted from the body through urine. Less urine production makes this toxin more difficult to remove. On the other hand, too much fluid intake also has a negative effect on kidney functions. Too much fluid intake can increase blood pressure, and high blood pressure can stress the kidneys. Unless directed otherwise by your doctor, it is best not to dehydrate your body. Step 6. Limit your exercise level. When the body does vigorous exercises, it converts food into energy more quickly. As a result, more creatinine is formed and the amount of creatinine formed in the blood increases. Exercise has great health benefits, so you may not want to take exercise out of your life completely. You should choose low-intensity exercises instead of high-intensity exercises. Try walking or practicing yoga instead of running, lifting weights or basketball. Get good sleep. When you sleep, most of your bodily functions are reduced. This includes metabolism. This means that creatine is converted into creatine more slowly. Meanwhile, many of the creatinine in the blood can be filtered out before other toxins are formed. Try to get 6 to 9 hours of sleep each night, 7 or 8 hours is ideal. In addition, lack of sleep can put physical stress on your entire body, forcing your organs to work harder to perform normal tasks. As a result, your kidneys can be stressed, which can reduce the kidney's ability to filter creatinine. Ask your doctor about stopping certain medications. There are some medications associated with high creatinine levels. Drugs that cause damage to the kidneys pose a risk. However, some drugs used in the treatment of kidney disease can also cause problems. If you have kidney disease, be careful about medications such as ibuprofen. These drugs can damage the kidneys when used regularly. ACE inhibitors and cyclosporine are used in the treatment of kidney disease but may cause an increase in creatinine level. Some nutritional supplements, such as vanadium, can cause an increase in creatinine levels, so should not be used. Always consult a doctor before stopping any medication. While some of these medications may cause increased creatinine levels, the good side may be more important than the bad ones, considering why they were prescribed. Look for medications and supplements that can help. Depending on the underlying cause of the high creatinine level and your overall body health, your doctor may recommend taking certain medications or supplements to lower this level. Many drugs used to lower the creatinine level also treat the underlying condition that causes the creatinine to rise. Therefore, the doctor will diagnose the underlying condition before deciding which medication is best for you. Take diabetes medication to control your blood sugar. Diabetes is a widely known cause of kidney damage and therefore high creatinine levels. If you have diabetes, it is important to keep the insulin level at a normal level to prevent future kidney damage. There are some medications you can use to control your insulin levels. Repaglinide is a commonly prescribed drug in diabetes. The starting dose is normally 0.5 mg and is taken before each meal. The maximum dose is 4 mg and taken before a meal. Step 7. Use medication to lower your blood pressure. Apart from diabetes, high blood pressure is also a factor that causes kidney damage. Keeping your blood pressure under control will help prevent the risk of future kidney damage. Therefore, it will reduce the creatinine level. The doctor may prescribe benazepril and hydrochlorothiazide. Normal benazepril dosage generally ranges from 10 to 80 mg per day. Normal hydrochlorothiazide dosage ranges from 12.5 to 50 mg per day. Some antibiotics can be dangerous if used incorrectly. People with kidney disease need less antibiotics than people with healthy kidneys. Take medications that lower high creatinine levels. Ketosterol is often prescribed to lower the level of creatinine in the bloodstream. Ask your doctor if this medicine is right for you. The usual dose for this drug is 4 to 8 tablets, usually taken 3 times a day with meals. Other medicines that can be used to lower creatinine levels include alpha-lipoic acid, an antioxidant. Supplements can be used to stimulate the kidneys and neutralize toxins, including creatinine. You can use about 300 mg a day. Chitosan is a supplement used in weight management. It can also reduce the amount of creatinine in the blood. Benefits occur when taking 1,000 to 4,000 mg per day. Step 8. Identify and treat the underlying problem. High creatinine levels rarely occur independently of anything else. Oftentimes this problem is a symptom of a much more serious ailment. To permanently lower the creatinine level and improve overall health, the doctor must first diagnose the underlying problem and then treat it. Kidney damage and chronic kidney disease are the most common causes. This damage can be caused by illness, potentially fatal infections, shock, cancer, or low blood flow. Type 2 diabetes is also associated with high creatinine levels. Other possible causes include heart failure, dehydration of the body, excessive blood loss that causes shock, gout, physically strenuous exercise, muscle injuries, muscle diseases and burns. Look for cold laser therapy. Some evidence suggests that cold laser or low-level laser therapy can regenerate the kidneys and improve their overall function. As a result, your kidneys can filter creatinine more effectively. When cold laser is used on the adrenal glands located above the kidneys, it can reduce stress and improve sleep. When cold laser is used in the vagus nerve, 10th cranial nerve, in the neck, it can provide more blood to many organs including kidneys. Benefit from massage therapy. Massage therapy will increase blood circulation and reduce stress, allowing you to have a good sleep and relaxation. Step 9. Find out what blood purification therapy is. Although somewhat rare, people with severe kidney disease and consistently high creatinine levels may want to consider blood purification therapy known as hemodialysis or dialysis. Although this treatment is somewhat intense, it can be very effective. During the treatment, blood is taken from the body and filtered by a machine. This machine cleans creatinine and other toxins from the blood. When blood is cleaned, it is transferred back to the body. Consider applying to alternative medicine. Especially learn about micro-Chinese medical osmotherapy. This treatment is based on traditional Chinese medicine and may be beneficial for minor kidney damage. Medicated tubs may also work well, and their origins lie in traditional Chinese medicine. In micro-Chinese medical osmotherapy, traditional Chinese medicines are prescribed according to the patient's discomfort. Some of these drugs are applied externally, while some are applied internally with a device called osmoscope. Medicated tubs can increase blood circulation. This causes the body to warm up and sweat. Creatinine and other toxins can be excreted through perspiration. Consider dialysis as a last option. If dietary changes and medications do not lower creatinine levels, consult your doctor for dialysis. There are two types of dialysis, but the dialysis used to lower the creatinine level is called hemodialysis. In hemodialysis, waste, fluid and salt in the blood are filtered using a machine so that the damaged kidneys do not need to do this. Limit your sodium intake. Excess sodium can cause unhealthy fluid retention and high blood pressure. Both of these conditions can result in high creatinine levels. Eat a low-sodium diet. Avoid salty foods and beverages and consume low-sodium foods, if possible, of frequently consumed food products. If your sodium intake is not low, adjust your average daily sodium intake to 2 to 3 grams. Step 10. Pay attention to your protein intake. Avoid protein-rich foods as much as possible. Red meat and dairy products can be harmful to you. Creatine is mostly taken from animal products when taken through diet. Although these amounts are generally not harmful, they can cause problems in people with abnormally high creatinine levels. Remember that protein in your diet is essential for getting enough energy and bodily functions to function properly. Therefore, you should not completely eliminate protein from your diet. When buying protein, make sure you get it from plant sources such as nuts and legumes. Increase your consumption of herbal foods. Vegetarian diets are often recommended for reducing high creatinine levels and reducing the risk of kidney disease due to high blood pressure or diabetes. Eat foods rich in vitamin C like red berries, lemon juice, parsley, and cauliflower. Don't eat foods rich in phosphorus. Especially if your creatinine level is high, your kidneys may have difficulty processing foods rich in phosphorus. Therefore, you should try to avoid the following foods: pumpkin, squash, cheese, fish, shellfish, nuts, pork, low-fat dairy products and soybeans. Limit your potassium intake. When dealing with kidney problems, try not to consume foods with high potassium content, as potassium can accumulate in the body if not properly processed by the kidneys. Potassium-rich foods include dried fruits, banana, spinach, potatoes, beans and peas. Avoid creatine supplements. Since creatine is a waste product that occurs when creatine is broken down, using creatine supplements will increase creatinine formation in the blood. For the average person, this may not be a problem. Even if you are an athlete or bodybuilder taking nutritional supplements to improve your performance, these supplements may contain creatinine, so you should quit these supplements. Reminder: always consult a doctor before administering a treatment. Everyone has different health needs, so the recommendations here may not be suitable for everyone. Some may even cause you to have health problems depending on your specific circumstances. And lastly, please like and subscribe so you can keep learning accurate knowledge.